org/flu.
Talk 1470 is WWNN Pompano Beach and 95.3 FM W237BD Boca Raton. The Health and Wealth Radio Network, 1470 AM and 95.3 FM. The Health and Wealth Radio Network. Listen for the latest on nutritional facts on Food for Thought with your host, Jolie Root, Mondays at noon, WNN.
A bad back, heartburn, low libido, stiff joints, not sleeping well, got allergies, need to lose weight? If you want to feel better, please tune into my health talk show, Sunday mornings at 10, the Dr. Bob Martin Show, on Talk 1470 WNN.
Interested in Bitcoin? Here's a special announcement from Online Trading Academy.
Did you know that you can now trade Bitcoins on the Chicago Mercantile Exchange? This opens the door for everyday people to get involved investing and trading in the cryptocurrency craze. At Online Trading Academy, we teach you how to make money in the financial markets, whether the markets are going up, down, or sideways, with a patented, rules-based market timing strategy. For over 20 years now, Online Trading Academy has been educating people all around the world, and now you can get educated at their campuses in Broward and Palm Beach County. If you want to make more money in the new year trading Bitcoin, stocks, options, futures, and Forex, call us right now. You'll receive 2 passes for a half-day trading and investing class valued at $1,000 for free. Don't miss out.
Call 561-674-9800, 561-674-9800, 561-674-9800.
Want to lower your rate and payments, get rid of mortgage insurance, or get cash out? Find out about your best refinance options by tuning into the Get Mortgage Fit radio show with Alex Michaels and Carrie Kasem, Monday mornings from 10 to 11, where you'll learn everything you need to know about mortgage loans, today's rates, FHA, VA, and more. Call the Get Mortgage Fit show Monday mornings from 10 to 11 on WNN at 800-827-RATE, 800-827-RATE, or visit them online at newamericanfunding.com, NMLS 6606.
Creative Accounting and Tax Services reminds drivers, according to the U.S. Department of Transportation, texting while driving is a leading cause of traffic accidents and fatalities. Do your part. Put the phone down when driving. The life you save may just be your own. This message courtesy of our good friend Joel at Creative Accounting and Tax Services at 4201 North Federal Highway in Pompano Beach, locally owned for over 40 years. If you owe the IRS, call him at 954-346-3200. Again, 954-346-3200. He's the best pennies to dollars on deck.
Talk here. Talk there. Talk 1470 AM and 95.3 FM. The Health and Wealth Radio Network. WNN.
Life is turned upside down. I mean, it's a devastating thing. Life is turned upside down. I mean, it's a devastating thing. Nobody plans on having an accident. I often remark that, most of my clients were perfectly fine the day before they got into the accident. And these accidents, they can be life-changing. And I think actually, in our experience, that to some degree or another, almost all of these accidents, even the little fender benders, they tend to be life-changing because different stuff happens to the client that they've never, ever experienced before. They're thrust into a world that they don't know, that they don't understand, that is completely foreign and is completely upside down to everything that they held to be true. When you talk to me, I'm real. And I believe in this stuff. I believe in my clients. I believe in this. This is my cause. This is my life's mission. This is my passion. Life is turned upside.
Unique services or products that you want to get the word out? Are you looking to grow your business and you want everyone to hear the buzz about it? Do you have an amazing project or an idea that impacts our community that you want to share and get others involved in? Then you've come to the right place. You're listening to Community Connections with Norma G. I'm your host, occupational therapist Norma Guerrero, and I want to share our passions while connecting with our community. So now let's get ready to hear about what's hot, what's new, and what's happening on Community Connections with Norma G. Give us a call at 888-565-1470 and join our conversation.
Really didn't expect the traffic. I mean, less than 20
Okay.
times.
Welcome back to Community Connections. I am your host, Norma Guerrero, and you're watching us live. You can watch us live on Facebook at Community Connections with Norma G. And today is Monday, January 22nd, if I'm not mistaken. January 22nd, 2018. And I'm super excited to be here once again with you all. And I've had a very, very, yes, I'll take that call in just a moment. I've had a very busy weekend with working and going to events, and it's been a whole lot of fun and a lot of busy work as well at the rehab facility. And so I want to first say that you're listening to us on 95.3 FM, 1470 AM. You can also listen to us at AM 1470 on your iHeart app, on your iHeart Radio app. You can find me at ccnormag.com on my website, as well as you can go to Twitter or Instagram. Or again, like I said, we are live streaming on Facebook Live right now. And so we are in the middle of, as I've mentioned before in the past, the title sponsor of our show is the Encore Boca Raton, which is formerly known as Whitehall Boca Raton. And so as of January 1st, 2018, Care Right Centers acquired that facility, and they are bringing in as their mantra is the Care Right difference. And so there I have them up on the screen, the Encore Boca Raton Rehabilitation and Nursing Center at 7300 Del Prado Circle South, Boca Raton, Florida 33433. You can look them up at www.theencoreboca.com, and it's been very exciting to see them come in in the facility with some new programs, as well as some new energy, and as well as some new ideas in order to enhance the rehabilitation process, the nursing process. And so as an occupational therapist that's very close to that facility, it's very exciting for me to see the upgrades, the changes, and also just the heart behind providing patient-centered care. And so just wanted to just give a little shout out to them. We're in the process of putting together their audio and video commercial, and so I'm kind of just doing it, as they say, old school, just verbally. So give them a call at 561-392-3000 if you want to schedule a tour to, look at some of the changes and to find out about some of the new personnel and everything that got going over there. So I also want to just mention that the two guests that we have on today that we're going to be interviewing are going to be Dr. Zorik Spector, and he is an pediatric ENT otolaryngologist. And so I got that word down. He is a return guest. We had him here on December, and we talked about some very complex ear, nose, and throat conditions. And so we decided that we enjoyed the conversation so much that we invited him back on. He's affiliated with West Boca Medical Center, as well as he has his own very specialized practice with multiple physicians that have a very unique specialty in this area. They're all fellowship trained, and so we're going to get into all that as well to talk about just the basics of the ear, nose, and throat, sinus infections, ear infections, the tubes, tonsils, and adenoids, and all those things that I know nothing about that he's going to kind of enlighten us about. And so I know a little bit, but we wanted to bring him on so that we know that so many people have their young children that are going through this, and so we wanted to impart that information a little more slowly and a little more carefully. We're also going to have on Dr. Viviana Wiht. She is a cosmetic, family, and dentist that is located in North Miami Beach, and we are very much look forward to her talking about her practice on Risa's Dental Clinic, and she is a returning guest as well, and look forward to hearing what she has to say today about caring for your smile. So looking forward to that as well. I want to take a moment to talk about just a couple events that we have going on. We have the CBS 12 Health and Wellness Experience at Meisner Amphitheater, Boca Raton, Saturday, March 10th, 2018. It is free to the public for all ages. You can learn healthier lifestyle choices. And it also has great business sponsorship opportunities. There it is up on your screen. It's CBS 12. They annually or biannually, they do an event here in Boca and last year it was at Port St. Lucie. And they have this event where they open it up to the public. 3, 4, 5, 6,000 people show up. They have multiple vendors there in the community locally, and it gives you a more intimate opportunity to get to know those vendors in the community, whether it be health and wellness professionals or business professionals. I believe the intention is that it be a little bit more health and wellness. So I have a contact over at CBS 12. Her name is Erica Obando. It's ErikaObando. She can be reached at 561-681-3438. Her email is eobando at sbgtv.com. That's EOBANDO at sbgtv.com. And she can help walk you through the variety of sponsorship opportunities, from small ones to larger ones to the booths to the banners, etc. But more importantly, anyone who's listening that just wants to go, who's open to the public, I think it's a great opportunity for you to learn about the variety of services, not just the basic doctor or the basic hospital, but just a variety of alternative type of services that are available to help you and your family live great quality lives. So I'm just going to take one more moment before we have Dr. Specker on. I have Sarah Finkelstein on the phone. And so, Sarah, can you hear me?
Yes, I can. Hi,
Thank you,
Norma.
Sarah. And so once again, I have Sarah Finkelstein, and she is an insurance advisor, and she has been putting on these workshops here locally in Boca Raton regarding the subject of, will you ever be able to retire? And so I had a few minutes to kind of get you here on the line, Sarah. How are you? How are you doing today?
Doing great.
Great. Could you give me a little bit of an update about what your workshops are about and when your next workshop is that you have?
Okay. Our next workshop is actually going to be this coming Saturday, the 27th at 10 a.m. And basically what we're going to go over is retirement challenges that most of us are going to be facing sooner or later as we get closer and closer to retirement. So basically, the workshop is for people that are gearing for retirement and also for those people that may already be retired, because the information is valuable to both.
Excellent, excellent. And so what are the most common questions that people ask you?
Well, most common questions are, will I have enough to retire? Will I be able to do everything that I want to do? I don't want to become a burden to my children. What do I do to protect that eventuality? There's a whole bunch of concerns that people have. And basically, once we do planning for the what-ifs in life, then we can feel a little bit more secure that we will have retirement that we feel we deserve to have after working for 40 years or 45 years.
I know. And the reason why I find this subject to be so important is because I did spend so much time treating the elderly folks in the rehabilitation facility. And, oftentimes, their biggest question is, how am I going to afford the care after I finish my rehabilitation at home, or if they need long-term care placement? And so thank you so much for calling in, Sarah. Tell us again the date and the time and the location or the number to reserve a seat.
Absolutely. Thank you.
You're welcome.
It's going to be Saturday, January 27th at 10 a.m. We're going to be meeting in the conference room at Dunkin' Donuts, which is on Glades Road, just east of 445. And the number to reserve your seat is 561-404-9366.
Excellent, excellent. Well, thank you so much again, Sarah, and I'm sure I'll be seeing you in the studio hopefully over the next few weeks.
Absolutely. You will definitely see me. Thank you.
Thank you for sharing that information, and good luck with your workshop this weekend.
Thanks so much.
Great, great. We're going to take a quick little break here to take a commercial break for the sponsors of the show, and then we'll be right back with Dr. Zorik Spector.
Hi, I'm Mary Ellen Brinker, founder of the Brinker Education Initiative. Hi, I'm Mary Ellen Brinker, founder of the Brinker Education Initiative. We provide Hispanic students in South Florida who excel in STEM, science, technology, engineering, and math, financial support to achieve their educational goals. They are the youngest and fastest growing demographic in public schools, and 18 out of the 25 top best jobs in America are STEM-based. Give the gift of a college education at brinkereducationinitiative.org or contact us at 773-717-6828. That's 773-717-6828. When they succeed, we succeed. Our nation succeeds.
can guide and inspire you to create an authentic life full of vitality and joy. Contact me, Jane Robinson, Creative Living Solutions, at 561-305-2317. That's 561-305-2317. Or visit me at janelrobinson.com.
Multiple horrifying childhood dental experiences has inspired Dr. Vivian Wiht, CEO of Sonrisas Dental Clinic, to become one of the most compassionate dentists in South Florida. So if you're anxious or fearful about going to the dentist, Dr. Wiht is the dentist for you. With the latest in technology, Sonrisas specializes in dental, cosmetic, and orthodontic services, including Invisalign, teeth whitening, crowns, veneers, implants, root canals, cleanings, dentures, and fast braces. Call 305-944-0000 or visit sonrisasclinic.com.
Winning by not losing. Do you know that there are safe money strategies that can benefit you when the market goes up, yet protect you when the market goes down? Hi, my name is Sarah Finkelstein with Signature Advisory Group. I'll show you how you can have safety and opportunity on the same dollar at the same time. You know, most people know where to find safety, that's bank CDs, and most people know where to find opportunity, that's the stock market. But did you know that you can have both without putting your money at risk? I urge you to commit to your financial future. Make an appointment with me for a free consultation and get the life that you deserve.
You want to save time and not be in front of the computer, the dark room of the new photo generation. Let Mobile Portrait Pros come to you, offering business portraits, executive portraits, mobile headshots, actor headshots, and campaign headshots for political teams. Innovation at Mobile Portrait Pros serves Palm Beach County and beyond. Just call 866-443-0873. That's 866-443-0873. Headshots door to door.
Insurance companies, they're very skilled. They have guys just like me on their side who are doing what they do, and they're looking very, very critically at the case. So the best thing that I can tell clients is, really don't focus on the financial component of it, because really that's our job. That's what we do.
Can't wait to see you there. Now let's rejoin the show. Welcome back to Community Connections. I am here with Dr. Zork Spector. How are you, Dr. Spector?
Very well, thank you.
Great. I'm so happy to have you here. And Dr. Spector is a pediatric ENT otolaryngologist, and he specializes in disorders of the head and neck, ranging from hearing loss to cancer. And so we had you on the show back in December, and it was such a very interesting conversation that we had. And I'm very curious about just try and understand the difference between the ear and the nose and the throat. Do all of those organs work in unison with one another, or do you find them as three separate type of organs?
Well, actually, they do work in unison with each other. That's an accurate statement. That's why the specialty that we have is evolved as being an ear, nose, and throat specialist and head and neck surgeons. The ears actually connect in the back of the nose and the area called nasopharynx, and of course the nose and the throat are connected. So all these three organs act and work at the same time and simultaneously. So it is a very important part of many of our functions. Obviously the smell is part of it, the taste is part of it. These are all important parts of it. And of course, the most important of them is the hearing. Ability to hear is key in all functions.
Interesting. When you think about the different sensory inputs that we get into our body, and so right there, just between you have your auditory, your olfactory, and your taste. What's the word? The medical
taste. Actually,
just taste. Those three things help kind of navigate our life. And so when that gets affected, it really, we're not even including, obviously, vision. That's a whole nother thing.
And vision, obviously, is a separate specialty. Many, many years ago, vision was actually combined into it. And we're talking about 50, 60 years ago, it was kind of one profession. Some people still think that we are, also an eye doctor. doctors, but actually we're not. That the eye doctors are very separate because, again, about 60 years ago, it was recognized that ophthalmologists have a completely different set of problems and issues, and these two disciplines are very different.
Interesting. And so you have a practice in Boynton Beach, Florida, at Otolaryngology Consultants.
Correct.
And that's over at 10150 Hagen Ranch Road, Suite 100B in Boynton Beach, Florida, 33437. And you are affiliated with West Boca Medical Center.
Correct.
And what do you do? Is that where you do perform your surgeries?
Correct. So we affiliate with West Boca Medical Center, where we do vast majority of our operations. They have fabulous pediatric facilities, pediatric otolaryngologists, which is ourselves. What I meant to say is pediatric anesthesiologists, which is very important for us when we do surgery on children. We want to have very competent pediatric anesthesiologists available to work with us. There's also pediatric intensivists for those children who have very complex procedures and require postoperative care in the pediatric intensive care unit. They have pediatric hospitalists, of course, which help us manage the children who just can be admitted overnight or for an extra 2 nights while they're in the hospital. So it's a complex process which takes a number of different specialties and physicians to manage complex patients.
And how many physicians do you have in your practice?
So there's altogether 5 doctors in our practice, and 4 of us, we're all fellowship trained in a subspecialty of otolaryngology. So to just give an idea to your listeners and to you as to how this works, and after completion of the medical school, one can enter into the residency of otolaryngology, which is general otolaryngology. We generally do a year or 2 of general surgery and then at least 4 years of ENT, of general ENT. Those individuals who are interested in very specific areas of otolaryngology then can go on and do a fellowship, which is an additional 1 or 2 years of training, depending on the discipline. So 4 of us are actually pediatric fellowship-trained otolaryngologists, and one of my partners is a fellowship-trained rhinologist and skull-base surgeon. And actually, he's specializing in the disorders of sinuses and nasal cavity and nasal care.
So rhinology refers to the nose?
Correct. Rhinology refers to the nose and the sinuses, and of course the skull base, which is the area around the pituitary gland.
Okay. So when you break down the word otolaryngology, which I cannot believe I'm saying correctly.
You're doing a great
because
job.
last time I chopped it up 14 different. I tried to say it in Spanish, and I realized that it maybe it's Latin, I don't know, but I was trying to say laryngology, something like that, and it just wasn't working. So the laryngology part, or the larynx part, is the throat.
The throat.
What does auto mean?
Ears.
So
it's OTO.
OTO, so is that Latin for it?
It is Latin. It's derived from a Latin word. Well, it's
the Latin derivative.
Origin, and actually, I think in Spanish, sometimes people refer to us as otorhinolaryngologist or otorhinolaryngologist.
Okay.
So they include rhino, meaning nose, obviously.
I'll have to test it on my mother if she knows what if she translated. It's not a word that we've tossed around too much growing up.
Correct.
So as a pediatric ENT, ear, nose, and throat doctor, versus an adult ear, nose, and throat doctor, what would you say is the different complexities that you have?
So
I'm sure they're both tremendously complex.
Correct.
But just how does it differentiate moving into pediatrics?
Correct. So being a pediatric otolaryngologist, as I explained before, involves additional training. During that training, the entire time, 1 or 2 years, is devoted to the learning of the most complex, most difficult procedures and treating most complex and difficult patients. Usually it involves being in a large academic centers, big children's hospitals. And that's where all of us came from. So that really is the time when you devote to honing your skills and actually learning to recognize complex and sometimes very simple conditions that may go and be unnoticed by others.
And so when people come in with the average sinus infection or runny nose, congestion, there's, determining whether it's viral or what's the other word? I'm losing my terminology right.
Just a simple congestion.
Right, just where it'll pass through. Or does it need an
allergic,
antibiotic?
Right, exactly.
Or does it need an antibiotic? But when does it get, what type of symptoms do you start to see where it gets a little more complex than the average common cold or?
Okay. So, almost everything starts with runny nose when it comes to sinuses.
Okay.
If you talk to patients, you can almost always trace it to some time when it all began with a common cold, or many times people will come in and say, I have allergies. And a frequent question I will ask on that is say, well, have you had any tests that actually tell you that you have allergies? And many times they haven't. So it usually starts with one of these simple problems. These simple problems, when they remain untreated, can progress to more complex and more difficult problems. And sinus infections is just the extension of that process. Frequently, a sinus infection will start with a common cold, which just doesn't go away. It persists. You have persistent congestion. You can have facial pain. You have discharge, which frequently becomes green or yellow. It gets some colors to it. It comes and goes. It doesn't really go away. Cough is a frequent symptom of sinus infections. And that's the time when usually people go to their primary care doctor, they get treated, and majority of times it gets better. Primary care doctors are very adept at treating this initial episode.
Sure.
The time when it doesn't get better, the time when it continues to persist and doesn't improve, and the patient may respond to the treatment, but the condition can return in a short period of time. That's the time when usually the primary care doctors turn to the specialist and ask us to get involved in the care of the patient.
And at that point, does it usually require some sort of surgical intervention, or is it something more medically that you have, different medications or something that you can recommend or suggest?
So in our practice, we always look at surgery as the absolutely last resort in the care of the patients. We will always look at what medical treatment, what medical management is available for us to treat the patient with and see if we can get the desired result, or cure the patient, get them better, get them more functional. That's always the first line of care.
And what are some examples of that?
So usually, it depends on the condition. I think the most important part of what we do is diagnosing the right condition. Looking at the patient, evaluating the patient, listening to the patient, and then being able to determine what actually is the problem is. Sometimes the problem is not a viral or allergic. Sometimes it's a structural problem. There can be structural abnormalities which just won't allow you to get better without surgical intervention. Making that diagnosis is the key in a successful management.
And beyond some tools that you have in your office in order to perform your assessment, are there other types of tests that people need to go to outside of your office to get? Do you have to do a CT scan of the brain? Do you have to?
So actually, within our practice, we have all of the necessary equipment to be able to make a correct diagnosis. We actually have a CT scanner available to us right in our office. That is correct, yes. It is a specialized CT scanner. It's designed to just give us the picture of the sinuses and actually the inner ear structures when we need to. So we do have a CT scanner. We have fiber optic equipment to be able to look deep inside the nasal cavities, down into the throat, down into the larynx, the voice box, to determine if there's any abnormalities of the voice box associated with this problem, or if it's just problems associated that people have with laryngeal problems. So we do have all of that, and that's available to us. Absolutely.
And the number to your office, if somebody wanted to call you to reach out to you to make an appointment, if they needed to consult with you, what is your number?
Our number is 561-736-8141.
And the name of your practice again?
It's actually Otolaryngology Consultants, PA, and then within that we have the Center for Pediatric ENT, Head and Neck Surgery, and then we have the Center for Sinus and Nasal Care. Those are the two aspects of our practice that we really specialize with.
Do you love it?
Absolutely, every single moment of it, and have loved it for
the
30
kids.
years. It's everything.
They must come in crying, irritable.
Correct. It's often challenging, but we love what we do. All of us are very passionate about what we do. We all have devoted many, many years to train, to learn. We continue to learn now, and we teach. Part of what we do is teaching. We teach medical students. We present at national and international conferences, we try to share our knowledge and our experience with others.
It's, I understand that I don't deal with pediatrics as much as I deal with the elderly.
Of course.
But they're in a fragile state, just as young children are as well, and they're in pain. And, they're used to being independent and have lost some independence. But when you have the capacity to provide something to them that actually probably helps them feel better, and in my particular situation, it's usually movement and mobility.
Of course.
Or teaching them how to do something, actually, because I don't administer medicine, actually provides comfort because it gets them stronger or more comfortable, even if it's just tucking a pillow in the right direction, post-surgical or something.
Of course.
It's a very rewarding experience, taking someone who is kind of crying or uncomfortable and making them comfortable, and I imagine as health professionals that you can understand that.
Totally. And I will tell you, in what we do, one of the most magical moments for us is when we are able to see the child to be able to improve their hearing or restore their hearing.
Yeah.
It is absolutely fantastic to see that child look at you and be able to hear.
And we get that experience when we see them stand up and walk, or do a task for themselves that was important to them that they couldn't do before.
Absolutely.
The ear. I want to ask you one more question before we part ways today. Is that the ear is part of the vestibular system?
Yes, indeed.
If I'm not mistaken.
That is correct.
But I also understand that you have your occipital region, occipital lobe, the occipital lobe region, which also I believe controls some movement. Can affect movement disorders as well. You have this BPPH, benign
positional vertigo.
Benign, BPV.
Yeah.
But benign positional
it has
vertigo,
several names, but it's
which is the crystallizing of these cells. I know a lot of adults get it. Do children get that as well?
So not usually. That maybe older children, maybe into teenage years, but very infrequently. The benign positional vertigo is a condition that's associated mostly with adults.
Okay.
Not before 45, 50 years old when people can develop that.
And young children that have developmental disorders, not necessarily cognitive, but maybe movement disorders, are the ears affecting that somewhat?
Very much.
Do you find that in your practice?
Well,
I know you must work with the neurologist, the pediatric neurologist.
Absolutely. Very much so. I mean, again, a child who already has challenges, developmental challenges in the first place, if they have chronic ear disease and associated with decreased hearing, that magnifies their challenges significantly. So if we can improve their hearing, or if we can restore their hearing, then they have a much better ability to be able to deal with their physical challenges and their developmental challenges. So it is a very important part of what we do and the patients that we see.
Yes, because when we treat, it doesn't necessarily be the benign positional vertigo. It can just be the vestibular imbalance issues that when you take away, auditory stimulation or visual stimulation, it affects your balance, which affects your coordination.
Of course.
So, well, Dr. Spector, it is just always a pleasure to speak with you.
Thank you so much.
And these questions are really very, very interesting to hear the answers to them from your perspective and your point of view. And so I want to thank you. At West Boca Medical Center, as well as we want to thank the Encore Boca Raton for inviting Dr. Spector on here, and Kathy Swindle with always bringing together these fabulous guests here for the show. We are going to be coming back with Dr. Viviana Weish with Sonrisas Dental Clinic, and looking forward to speaking with her. Another aspect of the face, the mouth,
Oral
which
cavity.
I imagine that she deals a lot with infections as well, in the mouth as well. So thank you again for coming in. And Dr. Spector can be reached at 561-736-8141 at Otolaryngology Consultants in Boynton Beach, Florida. So we'll be right back with Dr. Viviana Weish.
Are you looking to simplify, focus, and live a healthier, balanced lifestyle? Hi, I'm Jane Robinson, certified health coach and founder of Jane Robinson Creative Living Solutions. I can help you create a personalized, holistic plan through natural living, creative space solutions, and through a system of Nourish and Glow essential oils. I can guide and inspire you to create an authentic life full of vitality and joy. Contact me, Jane Robinson, Creative Living Solutions, at 561-305-2317. That's 561-305-2317, or visit me at janelrobinson.com.
Hi, I'm Mary Ellen Brinker, founder of the Brinker Education Initiative. We provide Hispanic students in South Florida who excel in STEM, science, technology, engineering, and math, financial support to achieve their educational goals. They are the youngest and fastest growing demographic in public schools, and 18 out of the 25 top best jobs in America are STEM-based. Give the gift of a college education at brinkereducationinitiative.org or contact us at 773-717-6828. That's 773-717-6828. When they succeed, we succeed. Our nation succeeds.
Multiple horrifying childhood dental experiences has inspired Dr. Vivian Weich, CEO of Sonrisas Dental Clinic, to become one of the most compassionate dentists in South Florida. So if you're anxious or fearful about going to the dentist, Dr. Weich is the dentist for you. With the latest in technology, Sonrisas specializes in dental, cosmetic, and orthodontic services, including Invisalign, teeth whitening, crowns, veneers, implants, root canals, cleanings, dentures, and fast braces. Call 305-944-0000 or visit sonrisasclinic.com.
By not losing. Do you know that there are safe money strategies that can benefit you when the market goes up, yet protect you when the market goes down? Hi, my name is Sarah Finkelstein with Signature Advisory Group. I'll show you how you can have safety and opportunity on the same dollar at the same time. You know, most people know where to find safety, that's bank CDs, and most people know where to find opportunity, that's the stock market. But did you know that you can have both without putting your money at risk? I urge you to commit to your financial future. Make an appointment with me for a free consultation and get the life that you deserve.
You want to save time and not be in front of the computer, the dark room of the new photo generation. Let Mobile Portrait Pros come to you, offering business portraits, executive portraits, mobile headshots, actor headshots, and campaign headshots for political teams. Innovation at Mobile Portrait Pros serves Palm Beach County and beyond. Just call 866-443-0873. That's 866-443-0873. Headshots door to door.
Insurance companies, they're very skilled. They have guys just like me on their side who are doing what they do, and they're looking very, very critically at the case. So the best thing that I can tell clients is, you know, really don't focus on the financial component of it, because really that's our job. That's what we do.
Norma G and our guests to find out about what's hot, what's new, and what's happening in our community. Can't wait to see you there. Now let's rejoin the show. Welcome back to Community Connections. I am your host, Norma Guerrero, and we are live streaming live on Facebook at Community Connections with Norma G. Today is Monday, January 22nd, 2018, and I'm super excited to have Dr. Viviana Weich.
Yes, thank you.
Thank you so much for coming back. And she is a cosmetic, family, and implant dentist.
Yes, correct.
And you specialize in doing, you know, cosmetic dentistry and implant dentistry in your practice.
Yes, I'm a general dentist located in North Miami Beach. We see most of the time adults, but we see kids as well. And you were talking with a ENT doctor, and that's a great thing to talk about it, because in the dentist, you also can see some kind of features that can resemble the need to go to an ENT doctor, especially kids that come to our office that we know that they sleep with the mouth open, and the consequences that you can have, like a malocclusion, which is when you are biting bad or when you're having an open bite, and when the bite is in the wrong position and the patient doesn't sleep because his nose is completely blocked, you need to send the patient to the ENT. They need to say that.
So, because the way he and I were talking about it, Dr. Spector, was that many times it's the primary care physician that may be, suggesting the referral, but you, as the dentist that's kind of right there doing a big time assessment, of the mouth, of the oral cavity.
In the regular exam, we can see the tonsils. And sometimes you see the tonsils are huge and nobody says anything. But as a dentist, you are responsible and refer the dentist to the ENT, because if they have episodes of infection in their throat, like more of, I think it was like more of 2 times a year, sometimes they refer you and you need to have a tonsillectomy. If you are not sleeping well, if you are not breathing well, then you get lethargic during the day, then you get tired during the day, then you sleep with your mouth open, the mouth gets dry, you don't have saliva, you end up having cavities. So it's a whole cycle. Everything is related to each other, and it's very important that assess those things when you are very young, so you don't get all this ball of snow rolling and rolling and rolling, for example. Then you end up with neck pain, with a bad position, and it's horrible how many consequences you can have just if you remove the tonsils when they are 5 years old or 6 years old.
Wow.
And it's a very simple solution, and the ENT doctor, especially the pediatric, is the one who handles this type of situation.
That go ahead and remove them. You mentioned the cavities. Now, are cavities exclusive to? We think about that. We hear about it a lot when we're young kids.
Correct.
Brush your teeth. I don't want you to get any cavities. Because we're always encouraging children. My mom was to brush your teeth. Do adults get cavities as well?
Yes, of course.
As the same level of frequency, or
much less, because they already got the education that they need to brush their teeth since they are young. But when you are a kid, you are stubborn. It's more difficult to educate her in getting the proper education about cleaning, flossing, mouthwash, etc. When you get more mature, you know that responsibility is yours. And if you already went through a traumatic situation in the dentist, you will definitely be more careful. But you can get cavities at any age. For example, older patients get cavities because they have dry mouth. They're taking so many medications that the flow of saliva is less. So the buffer system where for example, you eat a candy. So you produce saliva. The saliva will help the pH to be stable in your mouth. And if it's not stable and it's very acidic, you end up having more cavities. Mm-hmm. So if you don't have enough saliva, the acid stays in your mouth and you are getting more cavities, especially in the neck of the tooth. So usually an elderly patient going to need a lot of cavities if they don't control the saliva flow with a special enzymatic mouthwash or other kind of treatment that can be peeled, that can be reducing the medication. Every case is different.
Yes, and so what is your standard, gold standard of how often you should brush your teeth and how often you should floss?
There is a rule of 2-2-2 that everybody learns in school. You need to brush 2 times a day at least for 2 minutes, and you need to floss, and you need to do mouthwash.
Rinse.
What will be the order? You will be brushing your teeth first, then you're going to be flossing, and then you're going to do the mouthwash. And now there is a new technology, which is the water flosser, which is like flossing your teeth, but with water. We have Waterpik or other products that are in the market that it's like water with pressure that you can apply to your teeth, and then you're going to see how good everything. It will feel completely refreshed. It will be more comfortable, and it's something that you need to do every day. It's not an option.
Sure. Now, last time that you were here in December, and Happy New Year, by the way.
Thank you. Happy New Year to you, too.
You talked about some of the specialty type of devices that you have in your office. The technology is advanced, and you've been able to acquire some of these devices in order to provide more advanced screening or decrease pain, types of devices so that people are getting dental care. What would you say is your particular specialty, surgical specialty?
I'm a general dentist.
Okay.
So we do a little bit of everything, but I have a background in oral surgery from Colombia. And I also did an internship in Jackson Memorial Hospital in oral surgery. So I do a lot of extraction. I do a lot of implants and gum surgery, but I'm not a specialist in that. So if I get something more complicated, I will refer it to the periodontist or the oral surgeon, or depends. Like the more gentle stuff kind of things, they go to the periodontist, and the wisdom teeth, the bigger surgeries, they're going to go to the oral surgeon.
Sure. Well, no, it's good to kind of clarify and to understand, because I think that that it's you having it's just like a primary care physician. It's
correct,
and it's so because that's who you visit, and you count on that person to be able to say, this is what I think you need to the next step. And so when you have that background and that history,
correct,
those internships or residencies, that's advanced training, that's great that you have that ability, because many times when I'm treating my patients, it's not what you know sometimes as much as knowing what you don't know.
Correct.
And then being able to communicate that.
That's true.
Is knowing what you don't know. And because I feel like that's where you help people the most, is getting them in the right hands, the right people. And so I think that I wore braces, and I had the good old fashions. And so the Invisalign, I think it's the greatest technology ever.
I know. Don't worry, I'm not going to take it out this time.
No, that's okay. The Invisalign, when did that kind of advance, the technology of that advance? Is that over the last 10 years, 15 years?
It has been for more than 20 years, but Invisalign have changed himself in all these 20 years. So it used to take forever. It used to have rough, big attachment in the tooth. It's like a piece of composite, like a white filling that you have to put in the tooth to actually move the tooth. But right now, there are they call the new technology in the actually Invisalign that it has a smaller attachment with more technology that they rotate the tooth easily. And with 20 aligners, 25 aligners, we get a case done. If you don't have the continued education in Invisalign, you will stay in the first level and you're going to do cases in 4 aligners, 40. What doesn't mean is 20 aligners is about 6 months to a year. 40 aligners is almost 2 years. So the new technology has shown us that you can finish a case much more easy, much more quicker.
Wow.
And it's more for adult patients. Everybody can use it, but nobody wants to have braces anymore. You don't want to have the square. You don't want to be the ugly Betty at work. If you're an attorney, you don't want to be in the middle of a judge. Oh, yes, I'm going to kill you. And then you smile and you have all these braces. So nobody likes to have braces
and the
right now.
reason why it's adults are a little more responsible with managing it.
Correct.
Versus the kids.
Yeah, and we say that you will never going to give this to a teenager boy.
They'll lose them.
They will lose them. You're never going to get it. Usually teenagers, girls, it's my goal. And between 20 to 60 years old, my older patient is 73. So anybody can use it. There are very low restrictions. And most of the time, it's for an aesthetic orthodontic. It's for you to smile properly, to have a beautiful smile. The occlusion and the bite that are more complicated, I will prefer to assess it with braces. But most of the time, I go with Invisalign unless the patient say, I'm not wearing it, glue that thing to my mouth, and that's when I go for braces.
Mm-hmm, mm-hmm.
Yes.
And it's obvious with your accent that you're bilingual.
Yes.
And what's your second language?
Spanish.
Spanish. Okay.
Yes.
And so that must be very helpful in your practice.
Yes. I am from Venezuela. I live in Colombia for a few years when I did oral surgery and pathology. And then I moved here to the United States, which I'm not moving from here, hopefully.
Yes.
And yes, we have people in the office that speak Portuguese, Spanish, and English, and also Hebrew. So we have for everybody.
For everybody, yeah. What part of Colombia?
Bogota.
Oh, that's where you studied.
Yes.
Yeah. No, my mother's Colombian.
Oh, nice.
But my mother married a Puerto Rican. My father. But my aunt, she married a Venezuelan.
Oh, so you have the whole South side in the group.
All my cousins they're Venezuelan, and so I've been to Venezuela, and so it was pretty cool. That's how I learned my Spanish, but here, from this side of it.
I love it over there, but it was too cold for me.
Too cold where?
In Bogota. I'm very Caribbean. I love the heat. Nothing with the cold for me.
Wow, yeah, I usually don't correlate Colombia with cold, though.
Oh, it's freezing. They call it the refrigerator, Bogota, because it's freezing 24/7 the whole year.
Excellent. And so what drove you into the practice of dentistry?
Myself. I have a very bad experience when I was little. I was traumatized about 6 years old. I went to the dentist. I have the most horrific experience. And then I have to try, and I like a lot of medicine and I like a lot of architecture, but they're not related at all. Mm-hmm. But in dentistry, you are able to build things, to make things with your hands, and it's very handy for me, and I love science and I love art, so I combine them both, and I end up in dentistry. That's my story.
I had a situation where I think I had a root canal here in one of the center teeth. I was 25 years old. It was like 20 plus years ago.
Okay.
So the tooth became loose.
Oh my God.
Yeah, and so a dentist, I believe it was a dentist, put in like a mesh screen behind
like
the
a wire.
tooth with some acrylic.
Correct.
And for many years, that just stayed fine, stable. So it's just across 3 teeth. And then 7 or 8 years ago, it started chipping. So then I'd have my dentist.
Done it again?
Yeah, like fill in the acrylic, like a little bonding work.
Okay.
It became a headache for me and then for him because if he didn't get it perfect, the smoothness, it irritated my tongue.
Correct.
So one of the things that I found very, very interesting about the various dentists it was the level of patience, that they have for their patients in that chair is really understanding that the tip of the tongue, the sensory endings of the tip of the tongue, they have to be super high.
You leave a little piece or a little thing that it's not smooth in the mouth, and the patient will come back in less than an hour when the anesthesia goes away and say, something is not smooth, something is rough, please clean it up. The tongue is very sensitive and gets irritated very, very easy. So the good thing right now is that we have all kind of different things to smooth out fillings and white fillings and any kind of composite like rubber, polishing, creams, diamond paste, all kind of things that will help you to make it nice and smooth. So what happened to the tooth? You still have it?
Well, he referred me, I think, to an orthodontist. I believe it was an orthodontist, and he ended up putting like a brace on the inside. And now, things get kind of caught in the brace, but I never have a problem with it again. So it was.
Amen.
He gave me the best advice to say, you know what, you need to go to this person.
Okay.
And and so now when I go back in for my regular cleaning and my regular checkups and whatever, he'll go, I'm so glad we did that. I'm so glad you took the recommendation. And so it's no longer a headache for him and or for me, other than just daily maintenance of it and stuff. But it's no one knows about it, and I'm not also interrupted by it. So
a great tool for that is the water pick, the water flosser.
Yes.
And we have a lot of our patients that after finishing their treatment of orthodontic or braces or Invisalign, they need to wear a retainer, which probably looks similar to yours. And we always give the retainer, and we immediately recommend water pick. And it helps a lot with the cleaning. And these patients cannot fail the cleaning every 6 months because we know that you're going to have more food trap in there and you're going to have more calculus, and you need to come and remove it as soon as possible.
Interesting. I've never had one, but I've never been able to fully comprehend what exactly a crown is. What does that mean when someone gets a crown?
A crown, it's like a hat. Imagine that you're going to put a hat on top of a tooth. They made with porcelain. They used to make it in gold. They used to make it in porcelain attached to a piece of metal. So that's what sometimes you see like a black line on top of some people's teeth because they used to be metal inside and porcelain outside. They also call it the jacket. Or what they do exactly is, let's say you had a root canal. The tooth is very sensitive. It's very fragile after the root canal because it's dry, doesn't have the blood vessels anymore. So we need to trim the tooth all around, and we need to put something like a cast on top of the tooth so the tooth doesn't fracture. And this cast, we call it the crown. We make it in porcelain, and we also going to adapt it to the actual color that you have in your teeth.
So just like it's a crown, like a hat.
Correct.
Okay, so that's what it is. So you have a fragile or deteriorating tooth.
Correct.
And you put you fabricate a mold, a model of it, and then you're able to do that. So that's a crown. So then what's a bridge?
A bridge is that when you're missing one tooth, let's say in the future you lose that tooth, you're going to have an empty space in there, and you're going to have 2 healthy teeth right next to it. So what you're going to do is you're going to do crown in one tooth, crown in the other tooth, and they're going to glue them together with a fake tooth in the middle. So that's why we call it a bridge. Imagine the Brooklyn Bridge, 2 stand-ups on the side and 1 empty space in the middle. We connected all of them, and it actually looks like you
Does
do
it
have
stay
the tooth.
in or you take it out?
No, you glue it permanently.
Okay.
Okay, you don't take it out. And the crowns are also being used for the smile design. When you see these actors in the TV that they have all full, beautiful, white, big teeth, well, they're trim their teeth, and they're going to put full crowns in every single tooth, and they're going to do the color of the wall. They're going to do as whiter as you can, and that's how you get your teeth super white in the TV. Like a whitening, it's not enough to get that white. Your color has a limit how white they can be. But with these crowns, they choose like super bleaching color, and they're going to be like white as your wall.
Oh, well, so
Yes.
That's not is a veneer a totally different thing?
A veneer is the same, but it's only in the front. We just trim the front of the tooth and we put like a fake nail on top. That's a veneer.
Well, she kind of obviously knows her stuff. And so, Dr. Weiss, tell us where your practice is and where it's located and your website and all that other information.
We are in North Miami Beach. You can reach us at sonrisasclinic.com. And we also have a blog, which is drwich.com, which is DRWAICH, where we can see your videos and we can see like the last technology and the last thing we have done, and places are becoming famous. No, I'm joking. But all the new technologies that we are developing in the office, or the case I did today, I will publish it over there so you can see if something that you see in there is related to you and you say, you know what, this is the doctor I need to do that, and I wanted to do it like that.
Mm-hmm.
And we, if you want to contact through the phone number, it's very easy. It's 944-0000, 305-944-0000. And we are located in North Miami Beach.
Excellent.
Thank you.
And so you talked a little bit about whitening, related to when we were talking about the bridge. When people if I just want some generalized whitening, is there different methods that you offer?
We have a method to do it at home and to do it in the office. To do it in the office is similar of what you see in the mall, but it's supervised. If you have a crown or a bridge, they don't change in color. So you need to know about it. If you have any of those in the front, or if you have a filling in the front, the filling it won't change in color because you're doing a whitening. So if you have natural teeth, you definitely can do the whitening. But if you don't, you need to do the whitening first. And if you are tired of your crown and it's a 10-year-old bridge, it's time to change it.
Yes.
You change it, and definitely you do the whitening first, you wait 2 weeks, and then you choose the right color for your final work. So you can get the smile that you always want.
Yes, and that's important. And so, one of the things that, that's what I like about your card is that it has the teeth on it. So it's a really cool card. I think it's a great marketing tool. Is that, and branding, for yourself, is that Sonrisas stands for, I know.
First smile.
I know, stands for, I know what it stands for, just I can't get the R out, Sonrisa.
Sonrisas.
I know. And I can say Norma. I got it. I know. I just can't say Guerrero. I can't. Okay. You probably say my last name.
Guerrero.
See, there you go. It's what can I say? I was born here. But is that a lot of times people will say to me, often like one of the features, I like your smile. I like your smile, and it's super, super important that. Not only that, and this is going to roll into Alicia Curry's show. She's going to be on the show coming up next at 6:30 on Alicia Curry, personal branding expert. They're going to be talking about the importance of your smile for your confidence. And so not only is, caring for your smile great for hygiene and personal and for the odor of your breath as well, is that it's also, can affect your confidence in life and personal relationships and in business relationships. And so, Dr. Weich, I thank you so much for being here today and sharing.
Thank you very much for having me.
Your knowledge and your passion, your dedication for your specialty. So, give Dr. Weich a call. Weich, let me say it correctly, Dr. Weich, at 305-944-0000, and she can be visited at sonrisasclinic.com. Have a great week, everyone. We will see you next week.
Life is turned upside down. I mean, it's a devastating thing. Nobody plans on having an accident. I often remark that, most of my clients were perfectly fine the day before they got into the accident. And these accidents, they can be life-changing. And I think actually, in our experience, that to some degree or another, almost all of these accidents, even the little fender benders, they tend to be life-changing because different stuff happens to the client that they've never, ever experienced before. They're thrust into a world that they don't know, that they don't understand, that is completely foreign and is completely upside down to everything that they held to be true. When you talk to me, I'm real. And I believe in this stuff. I believe in my clients. I believe in this. This is my cause. This is my life's mission. This is my passion. This is my cause. This is my life's mission. This is my passion.
You've been listening to Community Connections with Norma G. We will be back next Monday from 5 to 6 p.m. with new guests to share about what's hot, what's new, and what's happening in our community. Did you hear something you liked today on our show? Please contact me, Norma G, at 954-802-2015 or email me at ccnormag@gmail.com. I look forward to helping you expand your business, project, or idea and connect with our community.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsor.